Good morning, everyone. Thank you for this invitation to present. My name is Vijai Bhola. I'm an infectious disease physician and currently a global health fellow at Boston. I want to thank Dinesh for inviting me to make this presentation. Dinesh is a colleague of mine. We met during the London School of Tropical Medicine and Hygiene diploma course a couple of years ago. So very happy that that professional relationship has led to this. I want to step back a bit in time before I talk about the US coronavirus response to ask ourselves the question, were we expecting this? And to quote Bill Gates at a TED Talk he gave in 2015, he said, "We're simply not ready for the next epidemic." He at that time stated that if anything was likely to take tens of millions of lives, it would be due to a virus, not to a war. And he made a very poignant comparison between the preparation the United States had as a child for nuclear war compared to the preparation it has presently for a viral crisis. And he said there basically was no comparison. We were prepared for nuclear war, but we had no plans for a national viral outbreak. Then on June 2019, Dr. Fauci stated that the thing that keeps him up at night, his worst case scenario, would be a respiratory illness that spreads easily and have a high degree of morbidity and mortality. And that is pretty much what we've seen. It's almost a prediction of what we're expecting. There have even been Netflix series about a coronavirus originated from wet markets, etc. So this is actually not something that was unexpected by any means. Individuals in the field were totally concerned about this type of thing occurring. And just to remind us a bit about the biology of coronavirus, it's not just about the fact that it takes lives, but one of the key problems with this virus is its ability to spread very easily to large numbers of people. Being a respiratory virus is a factor, but also the ability to spread even within asymptomatic populations. Then 2020 happened, and we were dealt with these staggering data as of September the 20th, where the US suffered 6.7 million cases and 198,000 deaths. And we have to ask ourselves, how could this have happened? To look at the context, the US has a population of about 4.3% compared to the entire world population, but accounts for 90% of the COVID deaths and 22% of COVID cases. So there really is a disproportionate degree to which the US is affected compared to all the other countries. And we also want to keep the context that the US remains essentially the world's richest country. And so we really have to ask ourselves, how did the world's wealthiest country manage to be caught flat-footed with such a deadly virus? So let's step for a minute and just think about the who's, the whys involved in a pandemic response. And I think the sentiments of one of the New York governors really echoes this quite well. His frustration basically saying that the response has been characterized by an individual statewide response rather than a coordinated, coherent national response. And that, in his statements, were the crux of the problem. His words on March 16, 2020, "This is not a war that can be won alone, which is why New York is partnering with our neighbor states to implement a uniform standard. I have called on the federal government to implement nationwide protocols, but in their absence, we are taking this on ourselves." So prominent within the US around that time were this sort of disagreement between governors as to whether people should be allowed to travel safely from states, whether there should be quarantines, the local population being, some people being anti-quarantine, some people being pro-quarantine, anti-mask, pro-mask. So there was really this air of, I would say, confusion as to what would be the right steps to make. And for example, Mr. Cuomo started meeting with neighboring states, for example, New Jersey, to sort of have a localized agreement as to what sort of measures they should take. As Cuomo said, it made no sense that New York had certain restrictions in place, whereas someone could just drive across from New Jersey in a couple minutes and upset the apple cart, so to speak. There was also a huge concern about the ability to obtain PPE in the early outbreak, with states basically having to wager against each other, sort of bet and auction for the to the highest bidder in a sense to obtain PPE for their states. Whereas this would probably not be appropriate. A more appropriate way it would be to have a distribution system that allocates resources to the hotspots as they are needed, and then moving on to other hotspots as those needs arise. We do want to take a step back. I like this statement attributable to Professor Chris Whitty. This is something he said during our diploma course in London, where he made the statement, "Health is political." He is the CMO and governor, health advisor to the UK government. And the context here is that health is expensive. It accounts for a large proportion of government's budget. There's strong public opinion and backlash and massive economic consequences. So health in general and health crises in particular are issues that are always in the foremost of politicians. To understand health, as with anything, any disease, we have to understand all the context: historical, economic, political, the demographic, and the geographical context, and how these factors interfere with disease biology. It's correct for any disease such as diabetes and high blood pressure, and it certainly is the same for infectious diseases, and in the context of outbreaks, it is even more acute. So to understand what has happened in the US, we need to understand a bit about the geopolitical history of the US. This is how the US began in 1776, with many states agreeing to join. It was a union. They also maintained the ability to leave if they so desired. So written into the constitution of many states is a statement saying, hey, we can leave at any point if we do desire to do so. The territory continued to expand, and it continued to expand over the years. There was one point during the American Civil War in 1861 where a large portion of the country seceded, but as we know, these areas rejoined the Union, so to speak. And this is what the US map looks like now. So there are 50 states, and there's widespread geography. Added to the original 13 are now states such as Alaska and Puerto Rico, even states in island states such as Guam and American Samoa, the Caribbean, in the Pacific. So it's a very disparate geography. And what's important to understand politically is each and every state. So for example, if we take Texas, the state of Texas has its state governor who dictates policy within Texas. And within Texas, for example, each city, so Austin, Houston, for example, would have mayors, and the mayors within states also have a significant amount of power. And the overarching government is the US government or the federal government. So this separation of powers is deliberate. It's seen by the founding fathers as an effort to prevent dictatorship, but it also has the aspect of an ability to create some confusion as to who's in charge at certain times. So we look to the state governments. When we say the US government or federal government, it's important to note that even the US government has many separation of powers. Again, as a guard to dictatorship, you have the legislative branch, which makes the laws, the executive branch, which is essentially the president, the vice president, the cabinet he appoints, and then there's the judicial branch. And so organizations we may have heard about are the CDC and the NIH. The CDC is the U.S. Public Health Organization, currently headed by Director Robert Redfield. And then there's the NIH, headed by Director Anthony Fauci, who's been around for quite some time. These two organizations fall directly under the White House via the Office of Health and Human Services. But interestingly, the budgets tend to be controlled by Congress. So there is, again, some sort of dual control over these organizations. So this is the question: who's in charge of a national response? And it means that a certain degree of cooperation and coordination is required. There's a certain amount of honor system, so to speak, that is required. Then in late 2019, an event that changed the world, and it occurred in this area. So this is Wuhan, and I want to point out the location of two countries that we'd mention. Taiwan, which is 100 miles from the border, about 167 kilometers, and Vietnam, which has a land border that's 1,200 kilometers. We will look at these two nations because they seem to have done quite a good job in controlling the outbreak and have an excellent economic recovery, despite their very close proximity to the epicenter in Wuhan, China. So this is the wet market, which is considered to be the epicenter in the sense that many of the contacts could be traced from there. It's not clear whether the virus originated in, i.e. jumped species within the wet market, or whether the wet market was simply an area that many people contracted the virus, where the virus was spread person to person because of the large numbers of people. The Sentinel event, Dr. Lee posted on December the 30th, 2019 about a new cluster of viruses. And unfortunately, he was arrested for this, for being a rumor spreader. That was the initial response from the Chinese government, was to basically interrogate him and force him to sign a statement saying that he apologizes for spreading rumors. It's a very unfortunate event. He, as we all know, would go on later to die on February the 7th. The context of what was happening at that time, what was he speaking about, what was he referring to, was that back in December the 12th, so sometime before that, fairly early December, officials were already investigating a cluster of patients with viral pneumonia around the Hunan seafood market. As we mentioned before, Dr. Lee was arrested shortly after his post, but at the same time, the Taiwanese response was to start traveler health screening. So while China sort of comes down with a very iron fist on its physicians, Taiwan sort of takes notes and begins screening travelers. The seafood market is shut down one day later. And then on January the 5th, a very important event, the WHO issues an alert that 44 patients with pneumonia of unknown etiology have been reported by the national authorities in China. So this was the time that the world would essentially become 100% aware that there is something going on within China. Context again, December the 12th, authorities were investigating clusters of pneumonia. So there we can see a delay between the authorities investigating in Wuhan and WHO making an international announcement. By January the 13th, China sees its first case. Thailand sees its first case, and then many other countries see cases within the next 10 days after that. By January 20th, Taiwan sets up a control center, and the US says it will begin screening. However, screening at 3 airports. This is January 20th. By January 21st, the first US coronavirus case is seen, and this is in a patient returning from Wuhan. Again, this is 16 days returning after there's a WHO notification about a cluster of pneumonia cases in that very city of Wuhan. Evidence of human-to-human transmission was confirmed shortly thereafter. On January 24th, a very important finding that a paper published that confirmed retrospectively that the very first case was noted on December the 1st in China. So essentially we're saying that the outbreak had been around for 2 months by that point. By January 25th, one day later, there were 56 million people in lockdown in the Hubei province, the largest quarantine, nothing comparable to this in human history. And this begs the question, should this not have been a global warning? This is 16 days after WHO warns that there's a problem, and this is almost under 2 months that the first case was seen, should the world have not taken notice then that there is something going on that in under 2 months can go from one case to a lockdown of 56 million persons? This may have been a very good description of a black swan event, something that we simply did not expect, and therefore essentially ignored obvious signs. Taiwan begins to respond by restricting tourist entry, as well as Vietnam. Interestingly, by January 30th, Trinidad and Tobago, as well as Afghanistan, bans travel from China. In retrospect, were these nations reading the writing on the wall? Shortly thereafter, many other countries report their first cases. The WHO issues a global health emergency, and Vietnam upgrades its quarantine policies. By February 2nd, there's a travel ban issued by the US to China. However, by that time, Vietnam was already a step ahead in terms of accelerating PPE production. Public health emergency was declared shortly thereafter. And Vietnam essentially blocks entry from China by the 15th of February. What is interesting to note is that Vietnam has been escalating here its targeted lockdowns is very slowly but very actively accelerating its measures to control the coronavirus. The WHO on March the 11th declares COVID-19 a pandemic, which cases were already seen all over the world. Essentially, by that point, travel ban was declared in the US shortly thereafter. The US declares that travel ban, especially from travelers from Europe, because Europe at that time was very much in the throes of the pandemic. By March 16th, Vietnam makes masks compulsory. And what is interesting here is that while a country such as Vietnam was looking at masks and quarantines, the US really put its energy behind treatment methods. Testing of hydroxychloroquine was an issue which was quite controversial. It was recommended without real data behind it. Then by March 19th, California issues a nation statewide stay-at-home order, which is a pretty one of the first hefty lifting measures we can say to control the virus. But by that day, Taiwan essentially locked down to all foreign travelers. And Vietnam was already locking down to all international travels. So while in the US, just one state was telling its citizens to stay at home, we have two other countries essentially at the same time locking down its international borders. And we can see the effect that those early measures took in those countries and compare them to the fairly late measures that the US took. By April the 1st now, Taiwan was starting to look outward, pledging assistance to other countries. Vietnam went into a complete national lockdown. However, by later in that very month, by April the 22nd, Vietnam was actually lifting its lockdowns and actually focusing on masking and small gatherings, grounding international flights at the same time. That measure remained. The US very much looking at treatment methods. Remdesivir was approved pretty early. There's some controversy about how early remdesivir was approved. The data was not peer-reviewed, and the actual recovery time was something such as a 4-day recovery time, not necessarily a dramatic morbidity and a dramatic mortality benefit, which is something we would have liked to see. So within the US, remdesivir was approved. By May the 9th, this is months after, a saliva-based diagnostic test was allowed for at-home use. In May also, the US death mark passed 100,000, and Fauci testifies to Congress that this is likely an underestimate. The US puts a lot of funding into the vaccine, so the US really stepped up in terms of providing some of that funding that would help in vaccination production. And then by June the 4th, the controversy on hydroxychloroquine, which had been raging in the US, whether to use this or not, was an issue of real concern and confusion and discourse between hospital physicians. For example, should we use hydroxychloroquine or not? That issue was settled as studies were retracted based on saying that the initial data suggesting hydroxychloroquine was good was essentially very poor data. By June the 7th, Taiwan now eases COVID-19 rules. And at the same time, essentially, the US had 2 million cases. And simultaneously, we're easing social distancing restrictions. So we could see quite a difference in terms of how this disease was controlled comparing the US and Taiwan, for example. Another controversy, Gilead sets its price for remdesivir at $3,000, whereas the taxpayers could argue our taxpayer funds suggest via the NIH led to development of the vaccine. Why do taxpayers now have to pay for this remdesivir that they've already helped pay to present? Now let's look a bit at what the economic recovery has been as a result of the virus. This is a Google Community Mobility Report suggesting a link between mobility and recovery from the virus, and we see Vietnam out front. Vietnam is actually one of the countries that has actually started improving its GDP, whereas many of the other countries in the world is still in a recession. Taiwan follows very shortly afterwards, and we see the United States still pretty low down in the Mobility and Recovery Index. Again, this is just a Google Community Mobility Report. May even raise questions about personal privacy, but this is one data point that we have to look at and take into consideration. Another major issue here is the drop in unemployment as a result of the virus within the United States, which is pretty significant unemployment created by this virus. And this is a major economic impact. This is from June of this year. Then September the 22nd arrived, and we hit another landmark of 200,000 cases. A very sad day and a very sad landmark. And what is unfortunate is that we still are not seeing a national policy, a national agreement onto what are the measures to be taken for social distancing, etc. The measures that we know and the measures that we have seen work in other countries. In the opinion of Dr. Tom Frieden, the former director of the CDC, to quote, "Tens of thousands of people would not have died if the US response had been more effective." If we were to look at some of the death indices, deaths have simply continued to rise throughout this entire time period, and confirmed cases also continue to rise unabated, even starting to look a bit more exponential even as time has gone by. This does not bode well for the future. Another issue is that coronavirus affects Blacks and Latinos even more than the average population, and the suspicion is that Blacks and Latinos tend to work some sort of frontline jobs, for example, working in factories and food production, essential services, so to speak. We see sort of a 2.6 times chance of Black Americans contracting the virus compared to non-Blacks, but in essentially white Americans, and they have a 2 times higher rate of actually dying from the virus. American Indians also contract the virus at a much higher rate and have a much higher death rate. Lessons for the future. A unified US response in terms of a national response would be ideal. Early warning systems and containment, international cooperation would be very important in controlling this very early. Travel restrictions, quarantine, contact tracing, judicious lockdowns, sequential lockdowns seems to be some of the measures that have been successful. And in the cases of Taiwan and Vietnam, it seems that early discipline in these measures really saves lives and saves economies. It's a hard bullet to bite up front, but then those nations were able to sort of get back on track with their business. Vaccines and medications are important, but less so during early in the outbreak. And I want to leave these resources with you guys, which are very, very useful. I urge you to take a look at them and be safe.